Seniors, you've been told these 6 tests are essential. But what if some are quietly ruining your health, stealing your independence, and even risking your life? I know, it sounds crazy. We've been conditioned to believe that more tests equal more health. But for seniors, after a certain age, this common belief is a dangerous lie. Last year, 74-year-old Maria had a routine scan. It seemed harmless. 3 months later, she was using a walker. Not because of illness, but because of complications from that very test. I remember when my own uncle was urged to get a test like this at 80. What followed was months of stress, unnecessary surgery, and regret. That's why I made this video. In the next few minutes, I'm going to pull back the curtain. I'm going to reveal 6 common health checkups that, for many seniors over 70, are not only a waste of time and money, but can lead to a cascade of anxiety, unnecessary procedures, and even worse health outcomes. This isn't about medical advice. It's about empowering you with the knowledge they often keep hidden. It's about helping you understand the psychology behind why these tests are pushed and how to protect yourself from what could be more harmful than helpful. It's about understanding the nuances of aging and how medical guidelines designed for a younger population may not apply to your unique situation. Number 1. Routine prostate-specific antigen, or PSA, screening for men. Now, for years, the PSA test has been the go-to for prostate cancer screening. And for younger men, it can be a valuable tool. But here's the twist. For men over 70, the routine PSA test can often do more harm than good. This is one of those doctors won't tell you this moments. Not because they're malicious, but because the guidelines are complex and the default is often to screen. Why? Because prostate cancer, especially in older men, is often very slow growing. Many men in their 70s and 80s have prostate cancer that will never cause them any problems in their lifetime. It's so slow that they'll likely pass away from something else entirely, long before the prostate cancer becomes a threat. This is what medical professionals call overdiagnosis, finding a cancer that would never have harmed you. A high PSA result often leads to further testing, typically a prostate biopsy. Biopsies are invasive procedures. They carry real risks of infection, bleeding, and significant pain. Imagine the anxiety leading up to it, the discomfort of the procedure, and the recovery. And if cancer is found, even a very low-risk one that poses no immediate threat, it can lead to immense anxiety, sleepless nights, and the pressure to undergo definitive treatment, known as overtreatment. Overtreatment can involve radical surgery to remove the prostate, or intense radiation therapy. Both of these treatments carry severe, life-altering side effects, like permanent incontinence, meaning you can't control your bladder, and persistent erectile dysfunction, impacting intimacy and quality of life. Think about that for a second. A test designed to find something leads to treatments for something that might never have caused an issue, and those treatments severely impact your quality of life. It's a vicious cycle that can steal your peace and your dignity. So what should you do? This is a crucial conversation to have with your doctor. If you're over 70 and generally healthy, many reputable medical organizations now recommend against routine PSA screening. The focus should shift to symptoms. Are you experiencing changes in urination? Pain? These are reasons to investigate. But the routine screening, just because of your age, without any symptoms or significant risk factors, might be a trap designed for younger men, not for the wisdom of your years. But this next one, it's even more common and even more dangerous for people over 75. Number 2, aggressive blood pressure management if you have no symptoms. We all know high blood pressure is dangerous. It's a major risk factor for heart disease and stroke. But for seniors over 70, especially those who are frail, have multiple chronic conditions, or are already on several medications, lowering blood pressure too aggressively can be incredibly risky. This is a subtle danger that's often overlooked. The twist here is that while normal blood pressure guidelines are perfectly suited for middle-aged adults, for very elderly individuals, particularly those over 75 or 80, a slightly higher blood pressure might actually be beneficial. Why? Because stiffer arteries, common with age, sometimes require a higher pressure to push blood effectively to vital organs like the brain, preventing dizziness and maintaining cognitive function. It's counterintuitive, but sometimes your body adapts in ways that are protective. How does aggressive management harm you? Over-medicating for blood pressure can lead to severe issues. The most common and dangerous are dizziness, lightheadedness, and fainting spells. For seniors, these aren't just minor inconveniences. They are direct precursors to falls. Falls for seniors are devastating. They can lead to broken bones, especially hip fractures, which often result in long hospitalizations, loss of mobility, significant pain, and a devastating loss of independence. You might feel constantly tired, weak, groggy, and generally unwell, making it difficult to enjoy daily activities. Is a slightly lower number on a chart worth risking a life-altering fall or feeling perpetually unwell? The how you manage this is to have a very open and honest conversation with your doctor about your individual goals for blood pressure. If you're asymptomatic, not experiencing any symptoms, and your blood pressure is only mildly elevated, a less is more approach might be safer and more beneficial for your overall well-being. Focus on proven lifestyle changes first: gentle, regular exercise like walking, a balanced whole food diet, reducing sodium intake, and managing stress. These are powerful tools that come with no pharmaceutical side effects. And crucially, if you are on blood pressure medication, report any dizziness, weakness, or fatigue immediately. Your comfort and safety should always be the priority. But wait, this next test is one many of you get yearly, and it could be putting you at a huge unnecessary risk. Number 3, routine colonoscopies for average risk individuals over 75. Colon cancer screening, like colonoscopies, have undeniably saved countless lives. They are highly effective at detecting precancerous polyps before they have a chance to turn into full-blown colon cancer. But again, for seniors, particularly average risk individuals over the age of 75, the benefits start to diminish significantly and the risks become more pronounced. The twist is in the timeline of cancer development. The average person needs about 10 years for a small precancerous polyp to develop into clinically significant invasive colon cancer. So if you're 78 years old and you undergo a colonoscopy and they happen to find a polyp, by the time that polyp might become a life-threatening cancer, you could be 88 years old. At that age, many other health issues may arise, and the impact of a slow-growing cancer may be irrelevant to your overall lifespan or quality of life. The how this harms you is through the significant burden of the procedure itself. Colonoscopies are invasive. They require extensive bowel preparation beforehand, which involves consuming large volumes of laxative solutions. This preparation can be incredibly difficult, unpleasant, and dehydrating for seniors, leading to electrolyte imbalances, fatigue, and a general feeling of misery. The procedure itself involves sedation, which for older adults carries real and elevated risks, including adverse reactions to the anesthesia, heart rhythm disturbances, and respiratory problems. There's also a small, but very real, risk of perforation of the colon during the procedure, a tear in the bowel wall, which is a life-threatening complication requiring emergency surgery, extended hospital stays, and a difficult recovery. The recovery from the procedure can be uncomfortable, prolonged, and for many, it can be a traumatic and anxiety-inducing experience. What should you do? This is where shared decision-making with your doctor becomes paramount. If you've had regular colonoscopies throughout your younger years with no significant issues, and you're now past 75, it is entirely appropriate to discuss with your doctor whether continued routine screening is truly necessary for your specific health profile and life expectancy. If you have a strong family history of colon cancer, or if you are experiencing specific symptoms like unexplained rectal bleeding, changes in bowel habits, or unexplained weight loss, then a colonoscopy might absolutely be appropriate, regardless of age. Number 4. Aggressive cholesterol-lowering treatment, especially for primary prevention. For decades, we've been told that lower is always better when it comes to cholesterol, and statin medications have become ubiquitous. While statins are undoubtedly life-saving for certain populations, particularly for individuals who have already had a heart attack or stroke. For seniors, especially those over 75 who haven't had a previous cardiovascular event, the aggressive use of statin medications to lower cholesterol can be questionable and come with significant trade-offs. Here's the twist. While statins are undeniably powerful tools for secondary prevention, preventing another event after a first one, for primary prevention, preventing a first event in very old age, the scientific evidence of significant benefit is much weaker.
The how this harms you is through the common and often debilitating side effects. Statins are well known for causing muscle pain and weakness, often described as a generalized achiness or profound fatigue. For a senior, this muscle weakness isn't just uncomfortable, it can be incredibly dangerous, increasing the risk of falls and reducing your ability to perform daily activities. Statins can also cause memory problems and cognitive fogginess, which can be particularly distressing and scary for older adults already concerned about cognitive decline. Some studies even link statin use to a new onset of type 2 diabetes. You might attribute these uncomfortable symptoms, the muscle aches, the fuzzy memory, the lack of energy, to just getting old. What's the takeaway? If you're over 75 and haven't had a heart attack or stroke, have a frank, honest conversation with your doctor about whether statin therapy is truly providing a significant benefit that outweighs the potential for uncomfortable side effects and a reduced quality of life. The focus should always be on what truly improves your daily life. Prioritize heart-healthy lifestyle choices first, a balanced diet rich in whole foods, regular, gentle physical activity, maintaining a healthy weight, and absolutely not smoking. These are powerful interventions that come without the medication side effects. This next recommendation might make you question everything you thought you knew about bone health. Number 5. Routine bone density scans, DEXA scans, for women over 80 who have no other risk factors. Osteoporosis, or thinning bones, and the resulting bone fractures are a huge legitimate concern for seniors, especially women. DEXA scans are valuable tools that measure bone density to assess fracture risk and guide treatment. But for women over 80, the utility of routine scans can become less impactful, particularly if you've already been diagnosed with osteoporosis and are on treatment, or if your overall health status means fall prevention is the paramount concern. The twist here is that by the age of 80, it's a statistical reality that many women already have some degree of bone thinning, if not outright osteoporosis. For these women, the question is often not if you have bone loss, but how to best prevent falls and manage any existing bone loss to reduce fracture risk. Repeated, frequent scans may not provide new information that significantly changes your management strategy, but they can create unnecessary anxiety and financial burden. How this harms you. If you are already on medication for osteoporosis, repeated DEXA scans might show minimal improvement, even if the medication is working to stabilize your bone density. This can lead to a sense of frustration, feeling like the medication isn't doing enough, or a desire for more aggressive, potentially riskier treatments. More importantly, the focus can shift away from the single most crucial factor for preventing fractures in very elderly individuals: preventing falls. A DEXA scan tells you about bone density, but it doesn't improve your balance, remove tripping hazards in your home, or ensure your vision is optimized. It doesn't address the real, immediate threats to your bone health. So, what should you do? If you're over 80 and you've either been consistently screened with no major issues, or you have known osteoporosis and are on a stable treatment plan, discuss with your doctor whether continued routine DEXA scans are truly necessary. The energy and effort might be better directed towards strategies that have a more immediate and tangible impact on your quality of life. These include fall prevention strategies, like strength and balance exercises, assessing your home for hazards, reviewing medications that can cause dizziness, and ensuring proper vision and footwear. Also, maintaining adequate calcium and vitamin D intake under your doctor's guidance remains important. It's about focusing on practical, protective measures that truly enhance your daily safety and well-being. And finally, this last test is one that can cause immense emotional and physical stress, often for no real benefit. Number 6. Aggressive cancer screening for cancers with slow progression in very frail seniors. This is a broad category, but it's arguably the most important and sensitive conversation to have. We're talking about things like continued routine mammograms for breast cancer, or intensive screenings for certain internal cancers in seniors who are already very frail, have multiple serious, life-limiting health conditions, or a limited life expectancy due to other illnesses. The twist here is centered around the concept of competing risks. If a senior has severe, advanced heart disease, moderate to advanced dementia, end-stage kidney disease, or another serious illness that significantly limits their expected lifespan, the likelihood that they would die from a slowly progressing cancer is very low. They are, sadly, much more likely to pass away from their other existing aggressive chronic conditions. Therefore, finding a slow-growing cancer through screening might not add any meaningful years to their life, but the process of finding and treating it could significantly detract from their quality of life. The how this harms you is profound and often overlooked in the push for detection. Screening tests, even for seemingly simple ones, can lead to false positives, which then trigger immense anxiety and stress, and often lead to further, more invasive follow-up procedures like biopsies, which carry their own risks. If a cancer is found, even if it's slow-growing, the psychological pressure to undergo aggressive treatments like surgery, chemotherapy, and radiation can be immense. For a frail senior, these treatments can be devastating, causing severe pain, nausea, fatigue, a dramatic decline in functional ability, prolonged hospitalizations, and a significant reduction in their remaining quality time with loved ones. It is crucial to balance the potential, often theoretical benefits of early detection against the very real, immediate harms of diagnosis and treatment in a body that may simply not be able to withstand it. What's the approach? This is perhaps the most personal and sensitive conversation you will have with your doctor, and it's one where your values must be heard loudest. It involves considering your overall health status, your personal values regarding longevity versus quality of life, and your life goals for your remaining years. For some, knowing everything and fighting every potential illness is paramount, regardless of the cost to daily comfort. For others, maintaining comfort, dignity, and a good quality of life in their remaining years, free from unnecessary interventions, is the absolute priority. Be honest, be open, and be assertive with your healthcare provider about your priorities. Sometimes, and particularly in very advanced age or frailty, less medical intervention is not only more compassionate care, but leads to a much better quality of life. This is your life, and your decisions matter most. So why is this information so critical for you, our senior audience? Because your health journey after 70 shifts significantly. It moves from aggressive prevention and early detection at all costs to a more nuanced focus on quality of life and avoiding unnecessary interventions. This is about smart, personalized care that protects your independence and peace of mind. This isn't about ignoring your health or being reckless. Far from it. It's about being informed. It's about making smart health choices that are truly beneficial for you at this unique stage of life. It's about understanding that more tests don't always mean more health, especially as we age. It's about empowering you to have intelligent, well-informed conversations with your doctors, to ask the right questions, and to confidently make decisions that genuinely align with your individual health goals and values, not just what's routinely offered. It's about being in control of your health decisions, feeling confident in your choices, and not passively accepting every medical recommendation without questioning its relevance to your life. Let's quickly recap these 6 common health checkups you might want to reconsider or discuss more deeply with your doctor after 70. Routine PSA screening for prostate cancer in men over 70, due to risks of overdiagnosis and overtreatment. Aggressive blood pressure management that leads to dizziness, falls, or other significant side effects, as slightly higher blood pressure might be safer for some very elderly individuals. Routine colonoscopies for average risk individuals over 75, given the long progression of polyps to cancer and the risks of the procedure. Aggressive cholesterol-lowering treatment for primary prevention in very elderly individuals, weighing potential benefits against significant side effects. Routine DEXA scans for women over 80, without other specific risk factors, as fall prevention often becomes a more critical strategy. Aggressive cancer screening for slow-progressing cancers in frail seniors with multiple serious health conditions or limited life expectancy, considering the competing risks and burden of treatment. Remember, this is about personalized care, not a one-size-fits-all approach. Your unique circumstances, your wishes, and your comfort should always guide your medical decisions. The most important step you can take after watching this video is to open a dialogue with your healthcare provider. Don't be afraid to ask questions. Share your concerns, your fears, and your priorities. Bring this information to them. Your body, your choices, your life. Have you ever gone through a test that left you feeling worse, not better? Share your story below. You might help someone else avoid the same mistake. Your insights and experiences are invaluable and help our entire community learn and grow stronger together. You deserve care that respects your years, your wisdom, and your voice. And if you want more honest, empowering senior health advice that cuts through the noise and gives you the real truth about protecting your health and independence, we're here every week, dedicated to breaking down complex health topics into easy-to-understand wisdom, helping you live your healthiest, most confident, and most empowered life after 60. Click that subscribe button now and join our growing family of informed seniors. And don't forget to hit the notification bell so you never miss out on our next vital health revelation.